Basically, if the
Yeah.
testis becomes overheated, then it causes subfertility.
Yeah, oligosperm. Yes.
The cancer treatment, drinking, doping, smoking, all of these kills the sperm.
The abuse of these medications, that is steroids or androgens, or unnecessarily taking testosterone, they may all damage the testis. Hello, good evening, Jamir. How are you?
Doing well, thank you, sir. How are you?
I am fine, thank you.
I'm going to introduce you. Is that okay?
Yeah, sure. I am Dr. C. Sharath Kumar, sexologist and infertility specialist. I am PhD in male infertility and fellow in sexology from European Society of Sexual Medicine. Welcome to this Jamir's Healthcare webinar. And today we are going to talk about male infertility, particularly focusing on pre-testicular causes of male infertility. Just to brief you about the main causes of male infertility. Male infertility can be divided into three zones. That is pre-testicular causes, testicular causes, and post-testicular causes. That is the severe oligospermia or asthenospermia or azoospermia or teratozoospermia or oligoasthenoteratozoospermia can be due to any of these three reasons. That is pre-testicular means the genitals are normal. That is testis and the vas deferens and the penis, that is and the urethra. They are quite normal. Seminal vesicles are normal. Prostate is normal. But the testis is not producing the sperms, or it is not producing enough quality of the sperms. The reasons may be before the testis. That is, since the external genital organs and internal genital organs, namely penis, scrotum, testis, and the vas deferens, prostate, seminal vesicles are normal, the cause must be something before the genitals. That is called as pre-testicular causes. And the pre-testicular causes can be of various types. That is originating from the brain. That is the main factors may be psychological factors. That is the person may not have the enough stimulation to the brain to produce the enough hormones which control the testicular function, namely FSH, LH, and testosterone. That is the mainly psychological factors. Apart from that, the brain factors themselves. Brain factors can be from the hypothalamus or from the pituitary or from the other endocrine glands like thyroid or adrenals. So these are some of the endocrine functions which directly control the testicular function by releasing various hormones. That is gonadotrophic releasing hormone, follicular stimulating hormone, and luteinizing hormone, and testosterone. And apart from that, the thyroxine, that is thyroxine. These hormones directly control the spermatogenesis. And if these are not released in adequate quantity and quality, they may result in the testicular function failure. That is, the Leydig cells, Sertoli cells, they will not function properly and result in the azoospermia or severe oligoasthenoteratozoospermia. So that is the hormonal factors. Apart from the hormonal factors, the next comes the brain factors. There may be a tumor in the brain, or there might have been some accident resulting, brain, in the brain. That is what happens is the brain may have some tumor, or the person might have met with some accident, brain injury, and resulting in some sort of blood clot, which results in the malfunctioning of the hypothyroid, the hypothalamus, and the thalamus and the pituitary. That may result in result in the decreased release of the required hormones. That is the brain injuries. Apart from the brain injuries, there may be tumors, especially tumors in the pituitary. Craniopharyngioma is one of the known cause of azoospermia, and any tumor in the hypothalamus also can result in the decreased hormonal levels and result in the azoospermia. That is the second cause of the brain structural causes, that is injury or tumor. And the next is, of course, apart from the tumors and this one, there could be congenital abnormalities in the development of the brain itself. That is, there may be during the development, this one, there could be congenital abnormalities like congenital hypogonadotrophic hypogonadism, that is called as CHH. That is congenital hypogonadotrophic hypogonadism. That is, the gonadotrophin release is not there. FSH and LH are very low, and that results in hypogonadism also. That is, the gonads are also decreasing in size. That is congenital causes. Apart from that, there may be some congenital other deficiencies. That is congenital FSH and LH deficiency could also be there. And apart from these, there could be genetic disorders. Genetic disorders like Klinefelter syndrome, where there is XXY chromosomes, Reinfeldstein syndrome, Ulrich-Nura syndrome. These are some of the congenital abnormalities which results in genetic malformation that results in malfunctioning of the brain structure itself, that results in various changes in the hormones, again resulting in the hypogonadism, and that could be the low sperm count or azoospermia. And there could be congenital abnormalities in the genitals also, along with the congenital abnormalities in the chromosomes. That these are the congenital causes. Right. Apart from this, there are, tell me, Zam.
Right. So just to get it from my perspective and from listeners' perspective, pre-testicular form of subfertility is one where your private parts work, but there is some problem with the testis.
Yes. No, testis is normal. Testis is normal. Testis, both the genitals, that is the internal genital organs as well as external genital organs of the person are normal. Testicular size is normal, penis is normal, vas deferens is normal, the prostate is normal, seminal vesicles are normal, but they are not functioning because the hormones that is released from the brain, they are not working upon this.
Okay, so everything is normal.
That's called as pre-testicular. Yeah.
Everything is
normal or subnormal, normal or nearly normal.
Right. So it's normal, but the male is not able to slice the female. Because of hormonal issues, because of like some brain injury or tumor.
Or tumors in the brain. Congenital abnormalities. Genetic abnormalities.
So these are the
apart from that, apart from that, the general conditions like severe diabetes, severe tuberculosis, chronic illness, chronic renal disorders, chronic liver disorders, severe anemia, severe debility, severe weakness, they may also cause the pre-testicular cause where the sperm count comes down. That is because of the general conditions. All these chronic illness, they may result in
So all these result
they may result in
a terminology called
low sperm count or azoospermia.
Yes.
Low
and
sperm count or azoospermia.
Another terminology.
And there are other diseases also.
Aspermia, right? There's another terminology.
Azoospermia.
Azoospermia and aspermia.
Aspermia or hypospermia.
Okay.
That is oligospermia.
All these are pre-testicular.
May cause, pre-testicular causes. Apart from this, there could be the varicoses. That is the veins surrounding the testes. They are pre-testicular causes because before the testes, the varicoses, they supply
the vein on the test around
plexus, plexus of vein. That is venous pampiniform plexus. That is called as pampiniform plexus. They are the plexus of veins. That is the veins coming out of the scrotum. They form a plexus. That is the agglomeration of veins. Sometimes they get dilated. And these dilated veins, they increase the temperature of the testes and result in low sperm count. That is again a pre-testicular cause. Testis itself is normal. But the controlling veins, they get enlarged. And there will be a lot of venous plexus which surrounds the testis, and that increases the temperature of the testis. That is another cause.
So basically, if the
Yeah.
testis becomes overheated, then it causes subfertility.
Yeah, oligosperm. Yes, subfertility.
So the
And
veins,
apart from that,
veins act as a ventilator kind of a thing, where it cools down.
Yeah, sure. Yeah, they should be freely circulating. The way there should not be conglomeration of veins where there will be stasis of the blood vessels, that is veins, so that that cooling effect will not be there. Because there it is getting stasis there. That is where the veins, they get engorged. And because the temperature of the blood is more, that is always, the testis should be 2 degrees less than the temperature of the body. And that temperature which should be low, it will not be there. It will be of the same body temperature because of the increased venous plexus. That cooling effect will not.
Right. So how will,
apart from that,
how will a patient get to know that they've got a pre-testicular cause of subfertility?
Yeah, I will just complete another 2-3 causes. Chronic smoking may also result in low count, and chronic heavy alcohol, that causes low count because they damage the liver, and the metabolism of the hormone is they lost, and that may result in this one. And chronic illness like cancer can also cause low sperm count, and the drug misuse, drug abuse may also cause this one, and any chemotherapy or radiotherapy to the body, that may also cause the low count or azoospermia also. So these are the all the causes that the pre-testicular causes.
So all
which may,
the cancer treatment, drinking, smoking, all these kills sperm.
Not decrease. They decrease the sperm count, and it may decrease to such an extent he may become the hyperfertile, the subfertile. That is, he may not, the sperm quality and quantity may not be adequate to make the partner pregnant. That is, there will be count, but not adequate. That is oligospermia. Low sperm count. So these are the pre-testicular causes. And Jamil, you want to ask additional questions regarding the causes are concerned?
So so we've got endocrine disorder, which also causes pre-testicular subfertility in male.
Yeah, which one? Which one?
Endocrine disorder.
Yeah, I told you, endocrine disorder. That is the hypogonadotrophic hypogonadism, low FSH, low LH, low thyroid, low testosterone, and hyperprolactinemia. That is, prolactin, if it is increased, that will also cause hypospermia, that is oligospermia. If the prolactin level increases, that is also one of the cause. And thyroid hormone, if they increase also, hyperthyroidism, they may also cause subfertility. So some of the hormones, if they increase also, they will cause low count. If they decrease below the required level, then also they may cause low count. That should be in the range, that is within the permitted range.
Right. So for my understanding, pre-testicular is a terminology used when there is no physical malfunction.
Testis is normal.
But
testis is normal. So the main thing is both the testes are normal. Size, shape, and position of the testes are normal.
Yes, but endocrine.
So that means testicular cause is not there.
Yes. So, but endocrine disorder, pituitary glands.
Pituitary, hypothalamus, thyroid, endocrines,
obesity,
general condition,
low testosterone, medication.
Drug abuse.
You have included narcotics, but does steroids also impact pre-testicular?
Steroids. That is the medications, several medications, cytotoxic drugs. And the steroids, they may also cause hypospermia, that is oligospermia.
So, for example, there is a bodybuilder, a male bodybuilder, and he consumes a lot of these protein powder, and in some way, form or the other, steroids are involved in that. powder. Will it impact his
Definitely,
subfertility?
definitely. Yes, yes, definitely. The abuse of these medications, that is steroids or androgens, or unnecessarily taking testosterone, they may all damage the testes. They all come under pre-testicular cause, because the testosterone or the proteins, they have got a range. They should not go beyond the range, not required beyond the range. For example, the testosterone, the lower range is about 145, and higher range is, the highest range is about 963 nanogram per ml. And if it goes beyond also, then there will be boomeranging effect. That is negative feedback effect, and that may result in the same cause. That is what I told you. It may result in the hypospermia, that is oligospermia.